Welcome to the Bind webinar series, Health Insurance, Up Close and Personal, where we bring together industry experts, thought leaders, and innovators who bring an entirely new kind of thinking to health insurance. Before we get started, a few housekeeping items to help you get the most out of your webinar experience. All windows on this console are interactive and adjustable. Feel free to move and size them to make the webinar more personal for you. If you experience issues with the audio or video, please try closing any other applications or browser tabs and refresh this page. If that doesn't work, refer to the tools icon in the bottom for further technical assistance. Throughout the presentation, we'll be answering questions in the chat. Feel free to type your questions into the chat box and we'll get to as many as possible. And now, please welcome your host, Tamra Lair, Chief Analytics Officer at Bind for What is a Personalized Health Plan?
Hello, everyone, and welcome to the first in our webinar series, Health Insurance, Up Close and Personal. The series will touch on some of the key tenets of health insurance that need to change, in our view, and what Bind is doing about them. I'm Tamra Lair, Bind's Chief Analytics Officer, and I'll also be our Oprah for today, or if you're old enough to remember, maybe I'm your Phil Donahue for the series. I'm thrilled to introduce Carrie Maurer, Bind's Chief Marketing Officer, who's done a lot of work and a lot of thinking on the idea that we need a new category of health insurance, like the categories we've come to know and love, like PPOs, HMOs, CDHPs, all that alphabet soup. Only this category is the personalized health plan. Carrie, thanks for chatting today. Let's just start at the beginning. Tell us what a personalized health plan is and the ways in which it might differ from other traditional health plans.
Thanks, Tamra, and great to be with you today. And yes, I do remember both of those characters. So it's interesting. Health isn't this thing that is disconnected from me. It's connected with me and touches every part of my life. And healthcare needs are different from person to person. Financial ability is different from person to person. Geography is different from person to person. Preferences are different from person to person. So why then would we think a health benefit designed to work the same for everyone is the optimal design? And how does a health plan designed to work the same for everyone address the fact that I may make $35,000 a year and my colleague makes $350,000 a year? Or how does it meet my needs when I live in a rural setting versus someone who may live in a major metropolitan area? Or how does it meet the unique needs of a person of color or someone with chronic illness? So a personalized health plan brings together the data and technology needed to truly deliver a health benefit that meets the individual needs that we each have and helps each of us make informed choices before we make care decisions that are right for our unique healthcare needs and circumstances and preferences. We had in an annual enrollment experience, we had a single mom approach us. And when she realized her personalized health plan gave her upfront prices, coverages from day one, and cost certainty, she was in tears. And she was in tears because up until that point, the lack of knowing what healthcare was going to cost her prevented her from getting the physical her kids needed to, play school sports. And so health is personal. Our budgets are personal. Our preferences are personal, and health insurance must be personal too.
Those kinds of stories are just too frequent, and it's exciting to think that we may have a different kind of solution for all the stories that are out there like that. So let's unpack this a little bit more. Talk a little bit about what the net effect to employers who might offer this personalized health plan are, and then kind of the other piece of that is what's the impact that a personalized health plan has on members? How do they kind of experience this approach differently in this new health insurance category?
Absolutely. So let's start with the employer perspective first. So, the employers that Bind has the privilege of serving, without exception, want to offer quality benefits to their employees, as they see health benefits as a way to retain and attract talent and demonstrate the commitment that they have to the individuals who are the lifeblood of their organization. But they need a benefit design where they don't have to choose between either breaking the bank or pushing more and more of the cost to their employees. And a personalized health plan delivers both a better benefit while reducing employee and employer spend. And that's the magical combination. The other thing that I'd mention is a personalized health plan allows employers to take action to improve health inequities. And that includes setting policies, practices, and subsidization strategies to actively and affirmatively address health disparities, improve care navigation that reflects unique racial, cultural, ethnic, LGBTQ needs that their population has. And when you think about the talent race, as that intensifies, personalized health plans really deliver a differentiated employer experience from a benefits perspective for job seekers. We had a person reach out to us on social media recently asking us if we would tell them who all of our customers were. And when we said, why, that's an interesting question that we've not had before. And they said, well, I only want to apply. I'm looking for a new job and I only want to apply at organizations that offer Bind because my current employer offers Bind and I want to have that as my benefit. So when you start to have the health benefit be a differentiator in how people are looking at certain employers, that, it's impacting both the employer and the employee. More specifically, from the employee perspective, with a personalized health plan, you can see costs of care clearly up front in advance of care, and you choose the right path for your individual need. I don't know how many times have we gone into a store, maybe with one of our children, and they come over and say, Mom, can I get this? And your first question is often, well, what does it cost? And they have immediate access to what it costs. And then you say, okay, can I afford that? And is it valuable enough for me to pay that? And we wouldn't tolerate that experience in any other way. We wouldn't ever tolerate going in and allowing somebody to say, can I get this? I need this. And for you to have no idea what it costs. And so why in the world do we tolerate this in healthcare? We can't make informed choices. We can't compare and shop. We can't see the difference in quality. It's unacceptable that this is our reality in the year 2021 of all times, especially given that our health is one of the most important basic human needs. So when you think about it, what a personalized health plan delivers is the ability then to not only make decisions that are right for your personal needs, but it gives you the ability to be a good consumer of healthcare. We see less than 1% of our members reach their out-of-pocket maximum because they have the ability to make those shopping choices and they have the ability to see information, that are right, that helps them make those decisions. So when you give people coverage from day one, when you remove things like deductibles and coinsurance that create those barriers to care, or at a minimum dilutes the power of having health insurance, and instead you give people price tags where they have choice, they have cost certainty, they can see and compare treatments side by side, they actually make smart choices and informed decisions that fit their individual needs. And when you do that, everyone wins.
Right. I can relate to your story about kids asking about pricing, because my millennial adult child a few years ago, before we were on Bind, actually asked how much a particular visit that she was going to cost. And I said, I can't tell you. But her expectation was, of course she would know, because that's the way the world works. So that's a great,
exactly.
A great analogy. So you talked a little bit about the net effect to the employer, and also how it feels to be on the bind plan or a personalized health plan as a member. So talk a little bit about how a personalized health plan like bind may really have an effect on members' lives.
Yeah, so I'm going to geek out on you just a bit to answer this question, if you don't mind. And I promise not to do this much, but
I like you. Don't worry.
You like it? Okay, fantastic. We're in good company. So a personalized health plan really allows, as I mentioned, us to be good consumers, better consumers of healthcare. And when we are enabled with the ability to be a good consumer, here's what we see. We see, more than 30% lower usage of emergency room than leading industry benchmarks indicate is taking place. We see more than 80% higher physical therapy, occupational therapy, speech therapy usage. But not only are we seeing those treatments leveraged at a greater degree, we're seeing them at 11% less cost because people are making informed choices of where to get that care. On average, bind members choose virtual care 3.5 times more than members in other plans because it's at a $0 cost to them. And so, almost 40% less spend each month on pharmacy services than the leading industry benchmark. Again, because we have information in front of us and we can make informed choices. And so that's the effect of a personalized health plan on members' lives. It is choice and the ability to make and be a good consumer of healthcare.
So as by extension, then in terms of what you're describing there, when a health plan is personalized, I would think that would make a difference in terms of the decisions about providers and care that people are making. How does that sort of translate into real life?
Yeah, so this is actually one of my favorite questions when I get the chance to talk to people about bind. So most people who work at bind are also bind members, including myself. So seeking care for one of my children, I'm actually no longer starting with Google. I'm starting with the bind app, because the bind app starts with conditions, then treatments, then care options, and I can easily go to my bind and search for a condition, which is what I needed to do in this particular instance. And so I saw all my options. I could see clear prices associated with each of those options, and I picked one of those paths. So while at the doctor's office with my child, we go through the process and they're going to prescribe medication for her condition. So in the doctor's office, once again, I pull out my phone and I open up my bind app and I'm looking through this and I said, okay, I can clearly see that my bind coverage covers version of the prescription you're going to prescribe. So please prescribe the generic version of that. And the provider's like, okay, no problem. That's great. And then I proceed, before even them asking me, I proceed to say, and I would like that prescription sent to this pharmacy, because I can see on my app that that pharmacy for that prescription is going to cost me $15 less than if I went across the street to a different pharmacy. I need 2 of these. I need them for a few months. This is $30 a month that I'm saving. And the provider looked at me like, what do you have in the palm of your hand that's giving you this information? And you're, sort of, before I even asked, directing how you want to consume, and how you want to purchase, essentially. And I walked out of that doctor's office with my 17-year-old, and I am like, go me. I felt so empowered, and I felt like I had the ability to be a good consumer. And my 17-year-old was like, what's the big deal, Mom? And I said, you have no idea what just happened, back to your daughter's example. And I think because the real life aspect of how we consume care and how we engage with the healthcare system, we've flown blind for so long that it feels great to have the ability to just make better decisions and be in control of that experience. So, as a consumer, this is real life, and this is the power of a personalized health plan and what it gives us.
Right. It's us Phil Donahue affiliated people that think it's a big aha experience.
Exactly. You got it.
As
Yeah.
usual, our children are way ahead of us. So,
Well, and I would love nothing better for this to work like the other useful services in our modern daily lives, right? That is how it should work. And so I'm hopeful they never have to experience it any other way. And I think that's the intention of a personalized health plan.
right. And that, I think that whole concept is so exciting. And how Bind is taking the personalized health plan concept and operationalizing it is also really exciting because it's the real life. So what's next as it relates to the personalized health plan category and Bind?
Yeah, a couple things I might mention is, Bind believes that health insurers and health insurance should play a leading role in addressing health disparities and is working to help employers create a truly inclusive, equitable health benefit. And I'm just incredibly proud and excited about how a personalized health plan is delivering both, a better benefit, delivering savings, but inside of that, really addressing the ability to address these disparities that exist within healthcare. So I would look for a lot more by way of how a personalized health plan delivers inclusive benefits. So that's one thing to keep an eye on, and I'm very excited about. I think the other is a personalized health plan really delivers a future where people can get to their best health affordably and have that information needed to make the choices that are best for our individual needs. So you can expect to see continued advancements in making the experience even more flexible, even more personal, even more intuitive. And so I'm very excited for what's on the roadmap as it relates to those continued enhancements. So
It's great. Those are big, big areas of focus and really exciting ways to break through long-standing issues that are out there as it relates to health insurance. So before we wrap up, because we have a few minutes, I'd like to just throw out one question that came in on the chat, if you don't mind. The question is, are people able to understand the Bind plan? This is new in all sorts of ways that you've described, and while we're joking about our kids totally getting it, in general, how are people able to understand? Is it something that is a barrier for anyone?
Yeah, so a data point I might use to help answer that question is when we survey our members, about 80% of Bind members report that they understand Bind better than their previous plan, and which is an impressive stat when you think about other studies that have shown 4% of people can accurately define basic health insurance terms like deductibles and coinsurance. And so the goal, certainly as a personalized health plan, is that it uses clear language along with intuitive plan design and intuitive interfaces so that people can easily use the benefit. We have health benefits and we want people to use those health benefits. And if you don't understand them, or you're confused, or you're fearful in any way, your likelihood of using it and using it effectively are minimized. And so that is, not only a data point that we watch, but an intentional approach that we have to ensuring that it is, easy to understand and that people can engage effectively with it. So.
Great, and thanks for the question, and to the audience, and thanks for your answer on that one, Carrie.
Yeah.
So thanks again for your time today, Carrie, and we also appreciate the audience coming today. Next time in our three-part series, the second part will be we'll be hearing from Bind CEO Tony Miller about how employer-sponsored health insurance needs to shift its focus really away from sick care. Should be an interesting and engaging session, and we'll look forward to seeing you soon.